Hi, everyone, and welcome to Life Bulb Live. Today, I have on a super awesome superhero. We are connected not just through Life Bulb, but in the cancer community, and I'm super excited to have this conversation. Yes, we are going to talk about telehealth, digital health, but I am sure that we're going to bring the conversation straight around to cancer and have a very invigorating conversation about it. So, Stacy, I'm going to bring you on, and I'm so happy to have you here.
Oh, I'm happy to be here, Annmarie. This is awesome. Thanks for having me.
Of course, of course. So, Stacey, can you just give us as we said, the three things about you and just give us a little 411 about yourself?
Yeah, sure thing. So, before I was a caregiver, before I was a patient, I was a 20-year healthcare executive in various functions across healthcare in physician practice management, sales, marketing, training. So I was on the delivery side of healthcare in healthcare management. I have an MBA and a master's in health administration. So I started working in across those different functions and across pharma. And along that journey, my younger son, Emmett, was diagnosed with a very rare chromosome disorder that has rendered him unable to walk, talk, care for himself in any way. So now he's 15, my older son's 17, but Emmett is 15 and he functions pretty much as a 6-month-old baby. And we have to do everything for him. So for him, I am a full-time caregiver, and that is my number one role. And just as I was getting his care sort of squared away, in 2014, I started having symptoms of abdominal pain, bleeding, fatigue, etc. And the one thing you got to know about me is I was like the healthiest person. I was a basketball and volleyball player across high school and college, fit, healthy eater, healthiest person I knew. So I started having these symptoms, and I really just dismissed them as, hemorrhoids or whatever. But I did finally go to the doctor, and she ordered a colonoscopy, thank goodness, because it revealed worst case scenario, stage 4 colon cancer. So I had quite a journey with that. And to the point where I just, that's a whole nother story for a whole nother time. But you can read it on my website, which I see that's up. But anyhow, I just hit 5 years cancer-free in October. So, woo, yeah, let's drink to that. And I also turned 50, and damn, I make 50 look good. So cheers.
You do make 50 look good. I'm approaching that next year.
All right, we will celebrate. So I am a caregiver, a patient, and an executive. So that really gives me a unique lens in how I approach things. And I do now have my own business of patient consulting, where I work with healthcare, pharma, biotech to connect them to their end user, the patient. Because I, probably like a lot of people, had this silly assumption that if you worked in healthcare, you understood patients. And sadly, that is not the case. So
that is not the case.
Yeah. So,
yeah. First of all, way to go, Supermom. I love the name Emmett, and I know how hard that is to caregive for anybody, and your child must be even harder. And that we'll have to have a whole conversation again another time about caregiving, because that is a whole different ball of wax. And then being diagnosed with cancer on top of it, you totally had my exact scenario. I was as fit as I could be when I was diagnosed. I was eating healthy. I was a personal trainer. I had just come out of the worst year of my life, only to get smacked with cancer. And that changes everything. It changes absolutely everything. And now with the way the healthcare is and doctor's appointments and everything is different. Everything.
Yeah, no, COVID certainly turned everything upside down. And I think that the biggest thing that COVID did, I mean, aside from the tragedy of COVID that it is, but in terms of the voice of the patient, it really leveled the playing field and empowered a bunch of us who were on the sidelines as patients, as caregivers, who maybe just felt kind of marginalized. It really brought that reality that anybody could be a patient. You could be, like we were, Annmarie, fit as a fiddle one day and struck down as a patient the next.
Absolutely.
And if you weren't used to that level of vulnerability, it really made you think. It's a life that you and I were used to, and many of our colleagues as patients, but for everybody else, it was a real eye opener. So it really, empowered the patient, and it brought about a things that we had been asking for years and years. They happened in a
in a heartbeat. And one of that is digital health, right?
Yes. Yeah.
We had no choice but to jump into it.
Yeah, huge year for digital health. So at the end of 2019, I do a lot on Twitter. I was over there and I saw HIMSS. For anybody who doesn't know HIMSS, it's Healthcare Information Management System Society. And they were asking for these digital influencers. So again, this is pre-COVID. And the work that I had done in healthcare management, I knew all about HIMSS. And I was looking at the criteria, and I said to my husband, I said, they need somebody like me. They need somebody who's going to stand up for patients, who's going to stand up for caregivers, and have a voice in digital health and how it should be shaped and everything. So I'm like, what the heck? I'm going to apply. I'm not going to get picked. They're only picking 10, but I'm just going to apply. And I will never forget opening that email. And I said, I won't swear, but I said, holy. And I just was like, oh my gosh. And then I started looking at the other people in the group, and they had like 50,000 followers, 20,000 followers. And I was like standing strong with my 1,000 followers. But, but that has been a tremendous opportunity. And like I said, it's not about me. It's about all of these other patients and caregivers who needed a voice in digital health. And little did we know, COVID was coming, and we would see these accelerations in telehealth and remote patient monitoring and wearables, et cetera. Yeah, it was awesome.
So one thing I think that's really important is that we need a combination of both. So this is why I'm kind of excited to have this conversation with you, because I am all about digital health. I think it's fantastic. It's a great way to connect with your doctor. You can get the care that you need or the questions that you need answered in a great way. However, I do believe that we can't just go to digital health. We still need inpatient visits. I mean, we need them both, but I don't want to lose either one.
Right. Agree. Well, about when you're a patient, you need options. Whenever you have options, that's a good thing. You went through cancer treatment. I went through cancer treatment. And as long as we knew we had options, we were in a good place.
Right.
So when you run out of options, that's where things start getting a little sticky. So, presenting a platform such as telehealth, it's just another option. So, for example, in my world, being a caregiver, my son now is 90 pounds. Lifting him into his wheelchair, into our accessible van, it's impossible for one person to do. And I'm doing it, to take him to the doctor.
Right.
Not to mention the fact that he's immunosuppressed. So you get into the waiting room and you're surrounded by germs. And I'm immunosuppressed as a stage 4 survivor. So, the fact that we could do, a routine visit or, what's something, genetics, seeing genetics, that shaves years off my life. I can't do it. So we did telehealth for genetics, and it was just ordering his blood work to get resequenced, et cetera. But it's an option. I'm with you 100%. Face-to-face is the gold standard. That is the preferred method. But if you can have an option of telehealth, that's a good thing.
Well, especially a scenario that you just said. I mean, that is the exact reason why we need telehealth. I mean, it just is. And I just had a friend who had a breast cancer check, and she had to do it through telehealth, and that should not be telehealth. Like she had to have her incisions checked, and in her defense, she couldn't get to the doctor, so she needed to have that option. She needed to have it, and it was an easy way for the doctor to look at her without her having to, deal with going in. But we need both. We just do, and I want that to continue, because I think that telehealth, digital health, is going to help so many people even get to that appointment that they might be, hesitant about, because they have that option.
Well, that's it. I mean, like you said, people who are in rural areas, who are miles and miles away from their physician, if we can overcome that geographic burden with, a telehealth option, it's a better connection for them to their
100%.
care. Where I get mad is, and this is something I advocate for. I'm in a group called Telemed Now, and I'm really excited about that. It's a group of 8 of us who are basically a thought advisory council for the continuance of telehealth past the pandemic, past the public health emergency. And we were, I just lost my train of thought, which happens. Hey, we're live, people.
Yeah.
We're live.
And not to mention cancer brain. Hello here. We're going to forget about it.
Oh, I know what I was going to say. What we see, you just helped me. We're live, people. Is access, universal broadband access. So speaking of that patient who is in a rural or underserved area, and they don't have access to internet. I could tell you stories and stories of patients that are accessing Wi-Fi in libraries, in coffee shops. That's the reality. And those are the people that we need to help. And it's this other thing about patient portals. If you're a health system and you're requiring a patient to be on a portal for their test results, you better be a stakeholder in helping to provide access to broadband for them.
Absolutely.
I mean, come on. So I mean, it should be a universal right. Yeah.
Yeah, I totally agree with that. I mean, and also there should be education around it, because you take older adults who are having to use telehealth portals, sign up for testing or whatever it is that they're doing. They don't know how to do it. They need help on how to access that. Like there's so much more than just saying, okay, well, we're going to have telehealth and you're going to have, you're going to be able to talk to your doctor digitally. Well, tell an older adult how they're going to do that, because they don't understand how to do it.
Well, that's a whole nother. I was just in a Clubhouse conversation at lunchtime about this today, and that's health literacy, Yeah. And I was saying, I likened it to, there should be a 2-to-1 ratio of patient education to implementation. In other words, for telehealth, there should be twice as much education for health literacy of how to use telehealth than there is to the actual, usage of it. No, and you just can't expect, somebody elderly, or how about somebody who is vision impaired, who is language impaired, who is, hearing impaired? How are they going to access a telehealth platform? What does that look like for them? So, health literacy is severely underappreciated and needs to have more attention. And that just got me started on something else, Annmarie. That just got me started. We're live. That just got me started on something else. And that is back to digital health, design thinking. And
yes.
Problem. Can we talk about that? Let's talk about designing from the patient up. You can't just be a tech company and say, oh, this is cool. Let's do this. Figure out the problem that you're solving for the patient, build from there up, and along the way, this what ties in, educate them on how to use it. That goes for remote patient monitoring, wearables, all these things that they're dumping on people. You better be showing them how to use it.
Well, and also, so you just got me thinking about something. It's also being not just ADA, compliant, but make it so that they understand it when they're having a difficult moment. I mean, there's no way during treatment that I could have functioned using certain apps because I couldn't think about it. Like, it was too busy. There was too much going on. My brain wasn't working that way. Do you know what I'm saying? Like, simplicity actually in a platform like this is so important. It can't have the bells and whistles that, Instagram and all those other pages have. It has to be an app or a platform that is very simple for you to use and clean, so that when I'm in a moment where I'm super stressed out and I'm trying to get the information I need, that I can get it and access it super easy.
Yeah, no, I couldn't agree more. I was talking to a tech developer, and I said, I need an app similar to I have a COVID tracker, and you open it up and it says, feeling good, no symptoms today. That's what we need for cancer patients, that just says, how do you feel today? Great, bad, awful, crappy, something. And you can check in every day, and then that goes right to your doctor. Now, I'm sure that exists, but I feel like if it did exist, because, the cancer community, we're so intertwined with each other. I feel like if there was a really good app, we would all know about it, because all we use.
I mean, I'm going to plug Transplant Life on Lifebulb for a minute, because Transplant Life is doing something similar to that. It's not just about forums and being able to answer your questions, but there's a journal on there. So you can journal everything from your headaches to your moods to what your poop looked like, because we all know when you're going through an illness, poop is like one of the most important things. It's right along with what you ate that day. What would be ideal and what is hopeful is that someday Transplant Life, we have different platforms, Cancer Life, MS Life, all the other disease areas, but you take that journal and you can transfer it right to your doctor and say, this is what my week looked like.
Yeah. Yeah.
Wouldn't that be ideal?
That'd be ideal. And I truly think we're heading that way. And we just got to make sure that we bring everybody along on that ride. Everybody.
Well, not everybody. There might be a few people. No, I'm just kidding.
Well, that's a whole, when we're not live.
And when we're not live. So I would be remiss to not talk about what this month is. So let's give a shout out to the blue.
I got my blue on. That's right. Blue is the colorectal. Yeah, you're out.
Sorry.
Fail. No. It is Colorectal Cancer Awareness Month, March, and our awareness color is blue. And, if people say, Stacy, what do you want people to know? What I want people to know is that I want you to have a conversation with your doctor about getting screened for colon cancer. And because colon cancer screening looks a lot of different ways. Everybody says, oh, colonoscopy. Well, first of all, don't get me started. I'm going to tell you that a colonoscopy is way easier than 55 chemotherapy.
100%.
Yeah, radiation and 2 surgeries, one of which almost killed me. So, it's very easy.
Wait, I got to rewind for a second. Did you have 55 rounds of chemo?
Yes.
Holy crap.
55. Yep. Yeah.
And screening is so important. So the only way we can screen for colon cancer is a colonoscopy, correct?
No, there's tons of different ways. You have a fecal immunochemical test, which is, you poop on a board. There's Cologuard, which has,
yes.
Everybody knows about Cologuard. There's a virtual colonoscopy. There are a couple different ways to get screened. These are all, I don't want to leave anything out. So I just want to tell people to talk to your doctor. Again, this gets back to our theme of options. There are options for colorectal cancer screening. So but you, being your own best advocate, have to ask your doctor about what those are. And the screening age is, lowered to 55 now. The insurance.
I just was going to ask that.
Yes, yeah. So American Cancer Society first proposed it, and then I always screw this up. United States Preventive Task Services Force. They are continuing. I think they just closed the comments. So the next step, we just got to get the insurances to pick it up. But the screening age will be lowered to 45.
It definitely 100% should be. I mean, I've had 2 colonoscopies because of my history, and
that lets you out of wearing the blue. That's what I wanted to hear right there.
Well, I'm supposed to schedule another one. I just haven't done it yet because I've had other scans going on. But I need to put my other one on because of my history. But that's because of my history. And I was talking to another one of our ambassadors, Lee, and he was telling me that colon cancer is actually hitting younger people as we speak. So lowering it to 45 makes complete sense. And, breast cancer, the freaking mammograms, they're saying 40, 45. Well, how do you have a baseline? If you have an issue, you should have a baseline significantly younger than that. So colon cancer, if you had it younger, that's your baseline. So you have something to go off of. Am I right? I mean, I'm not well versed in colon cancer. So.
Yeah, no, you're right on. You're right on. And you brought up.
I love it when I'm right. This is my favorite sentence. You're right.
But you said something really important, Annmarie, and that is knowing your family history. So no matter what age you are, if you have a family history of colorectal cancer, again, if you're 25 years old and you had a first-degree relative with colorectal cancer, like my kids, for example, they have to have those conversations ASAP. So any family history, any symptom at all, anything weird about your poop, anything weird about your bowel habits, your abdominal, you got to go talk to your doctor. Do not put it off. Go do it and just, stay ahead of it, because you don't want to be, where I was diagnosed at stage 4. So
no, you do not. I will say to you that having my kids have a history of cancer, like that kind of shook me a little bit that I put that on them. And I know that I didn't do it personally, but it did freak me out that they had that history because of me. And it rocked my world a little bit.
Yeah, I understand completely. And, but, we're just, we're just lucky that we, have communication with our kids so that they can take charge of their health.
Yeah.
And certainly, again, you just wrapping up with, cancer and COVID, you just don't know what's waiting around the corner for you. So everybody, live your best life today, maximize your healthy days.
Well, before we drop off, Stacy, I want to drop a bomb.
Okay.
So,
yeah.
you got colon cancer. I had breast cancer. And how do you feel about October for Breast Cancer Awareness Month?
Oh, I feel great about it. I have tons of friends, obviously, who, have breast cancer. Colorectal cancer, we are very envious of what you guys do in the breast cancer space. I mean, your awareness is off the charts. It's amazing. And I used to get pretty pissed off about them. I'm going to be honest with you.
Yeah, I'm pissed off about it because here's the thing. There's such a misconception that we have such great awareness. First of all, everyone knows that breast cancer exists. It's like one of the most talked about cancers. But, and I'm going to challenge you to do this October, when it's Breast Cancer Awareness Month, I want you to hashtag breast cancer awareness on Instagram and Twitter. And I want you to see the crap that comes through, because it's not about getting screened. It is these sexualization of breast cancer. It's, women in bras that never had breast cancer. It's feel the tatas. It's all this bull crap that should not be there. That's not what breast cancer is about. And me personally, I would love to see it not so sexualized and monetized. Breast cancer is the most monetized cancer that there is. And when you go to the store and you're buying that crap that's pink during that month, none of it's going where you think it's going. It's all going to some, who knows what. And I could tell you stories about it, and that's a different conversation. And I'm not looking to have that. What I'm looking to say is, as a breast cancer survivor, thriver, whatever the heck we're calling it these days, I'm angry that my cancer gets so much attention when yours doesn't. Like, I'm angry about that. It makes me really, really upset. Like, I want people to understand what goes on with colon cancer, pancreatic cancer, lung cancer, thyroid cancer. I mean, testicular cancer, all of them. We all should be getting the same amount. And don't even get me started about childhood cancer, because that gets the least amount of funding. 4% of government funding goes to childhood cancer. Yep. We need to do more in the cancer community, and we need to speak out of our community, just like we're having a conversation right now, so that we can bring in other groups and have them see that this isn't all tied in a pretty pink or blue ribbon.
Yeah, no, I couldn't agree more. I mean, every cancer is as important as every other cancer. And any of those, you got the good cancer, you got the bad cancer, whatever malarkey that is.
Such a load of crap.
The sexualization of breast cancer, get to third base or whatever the heck that says.
It saves second base, but we don't need to talk about that.
It's March Madness, so I'm out of my baseball talk. Sorry. But, no, any of that, it's appalling. And I just feel like we're all in this together. We should all be supporting each other. And and the marketing, every single one of those posts, Annmarie, you'll be glad to know, this is a shocker to anybody who knows me, but I call them out and I ask them,
I love it,
what percent, is going to research, and which research organization are they supporting? I call them all out on Instagram, all of them.
And I think, Stacy, what you just said is really important. So this month, if you are donating or you're buying something blue that has colon cancer, research on it, ask where the money's going. Make sure it is going to research dollars, because the only way to prevent colon cancer or to stop it from spreading or to cure it is through research. That's it.
No, that's it. I mean, as you said at the top of this discussion, you can be aware. We're all aware. Oh, I'm aware. I'm aware of breast cancer. I'm even aware of colon cancer. What are you going to do about it?
Exactly. Take action.
What is your action? What is your action? Yeah. Are you that's why I said, have that conversation about what your screening options are. Get your mammogram, know your family history, empower your children to take charge of their health. This is what we want to see as survivors. We want to see action. I'm sick of awareness. We're aware. That's great.
Turn the page.
Turn the page. Take the step. Do it.
Well, I loved this conversation. I adore you immensely. I'm so happy to be in your world, your circle, whatever you want to call it. Even if cancer did get us here, it doesn't really matter. I really do love what you're doing, and I'm super happy that you're part of LifeBulb. And I think this was a great conversation, not just about digital health, which is super important, and all the strides that we've made and need to make in that world, but also just about cancer and being aware that this is colon cancer, and talk to your doctor about your poop. Maybe that should be on a shirt.
Yeah, talk to your doctor about your poop. I like it. I like it. I'm down.
I think you should copyright that. I mean, you can copyright it and just send me a free shirt and we're good.
Okay, done and done. And everybody will know where the money's going towards which research. We'll be very transparent about where the money's going. It'll be going.
I enjoyed this so much, Stacy. Thank you so much.
Thank you, Annmarie. Thank you, LifeBulb, and everybody who tuned in today. We appreciate you. Get screened, stay healthy, stay well.